Hello, everyone. Thank you for taking the time to view this message. It's good to speak to you again, and I'll be honest, I very much miss the opportunity to speak with you in person, and I'm really looking forward to the day when we can return to those types of in-person forums. It's hard to fathom that we're in our 8th month of dealing with the impacts of COVID-19. As you recall, we went through some really difficult times in March and April, and quite a few of our coworkers were affected by the virus. Things improved throughout the summer, in large part to focused and needed actions across New York State to reduce the spread and to flatten the curve. Along the way, the lab has instituted a portfolio of mitigation measures that I know you've become quite familiar with. These have really helped to create a safe work setting for our staff and enabled us to continue the very important mission work of the laboratory. And as a result of these added precautions and improving conditions, we were able to begin welcoming more staff back to the lab. We entered phase 2 of the resumption of operations plan in early July, and at one point in early September, we were planning for the possibility of about 1,200 to 1,400 staff members coming back to the lab on a daily basis, both in science and in our mission support organizations. Unfortunately, over the past few weeks, we've begun to see a resurgence of cases in our area, affecting some of our colleagues as well. This mirrors the increase of cases that we've seen nationally, as well as within the state. It is deeply concerning to see our friends, our coworkers, and family members becoming ill due to the virus. The COVID task force has been reflecting on the past 8 months of experience that we've gained by working in this environment. We're reinforcing some of our controls, and we'll also be instituting some new measures. I worry that we're collectively feeling the fatigue of COVID, and we run the risk of letting our guard down. One of our safe conduct of research principles is a healthy respect is maintained for what can go wrong. And I believe that this fundamental premise is as important now as it's ever been. We all need to recommit to be as diligent in our behaviors, on-site and off, as we are and as we were in the spring and in the summer. You will see additional emphasis on COVID-19 in upcoming staff messages. Let me give you a few examples. First, experience and guidance associated with face coverings has been evolving as health professionals have been evaluating their efficiency. Beyond any doubt, the wearing of face coverings is one of the most effective personal actions we can all take. However, there's increasing feedback that we're getting lax in the use of coverings. In addition, data on the types of covering has evolved with time. In the coming days, you'll see new guidance coming out from our ES&H Directorate on the types of coverings to wear and the best practices for their use. Second, social distancing is an equally important principle. In light of the recent increase in cases, both locally and at the lab, we've begun to reduce our on-site staffing over the past couple of weeks. Where appropriate, managers have been using increased discretion to move more people back into a telework mode in order to reduce our on-site density. This helps to reduce the possibility of spread through close contacts. One of the things that we're particularly concerned with are the upcoming holidays. These are typically joyful times. College students are returning home. Family, friends, and colleagues gather to celebrate special holidays. Unfortunately, that means there's a non-trivial increase in the risks of transmission of the virus. Please, whether you're at work or at home, I encourage you to remain vigilant and make informed decisions about holiday get-togethers in the coming months. Too much is at stake in our region and in our country until we get through this. A third measure that we'll be instituting involves offering on-site COVID testing at no charge for employees. We've entered into an agreement with the testing laboratory to do this, and we're completing the final details for offering such testing. The details will be provided in a follow-up staff communication. Fourth and last, for those coming on site, please continue to be diligent about completing the daily pre-entry screening. It's one of our main lines of defense for stopping the spread of the virus on site. As we enter the next 8 to 12 weeks, I ask that you please be diligent in practicing the COVID mitigation practices, on-site as well as off-site. We want you, your families, your friends, and your colleagues to remain healthy. Remember the primary principles. Frequently check your temperature. If you're not feeling 100% well, remain at home. Contact your physician, your supervisor, and OMC. Wear your face coverings and ensure that they properly cover your mouth and your nose. And maintain safe distances in your interactions with others. Cleaning supplies are readily available for everyone's use. I use them, and I encourage you to do so as well. Please use the cleaners and wipe down common spaces that you use. In closing, the lab remains in really good shape, for which I want to thank and acknowledge all of you for your commitment and your hard work. Our staff has been proactive in preparing and maintaining a safe work environment for everyone. I know how hard this is, with all the challenges we face, both with COVID and beyond COVID. I miss seeing my children and my grandchildren. It's hard getting used to these new constraints. But getting through this requires us to stay healthy, which requires constant vigilance. It is crucial that we keep practicing safe distancing, masking up, regular hand washing, quarantining when necessary, and all the rest. Thank you for your efforts on behalf of Brookhaven Lab and the DOE. As I close, I do want to mention that the amazing work of the laboratory continues. Every day, you and your colleagues are hard at work in support of the vital work that the laboratory pursues. Whether you're at the lab or working just as hard at home, thank you. Let's stay safe, keep in touch, and keep going.